Okay, so we are going to pick up right off of where we left from class. We finished talking about sleep in this particular chapter for Intro to Psych. I wanted to reiterate a few of the points that were made previously about sleep and improving your sleep. So we found that you can really do a lot to improve your sleep by improving your habits around sleep. So, avoiding certain chemicals, avoiding certain foods, and changing the way that you approach sleep has been found to be very, very effective in improving your sleep. For example, we know that stimulants do exactly what they're supposed to do, and they stimulate you, and they can make it much harder for you to fall asleep. So, deciding to drink a cup of coffee close to bed or do a post workout or a pre workout really in the evening close to bedtime is likely going to keep you up at night. It's going to make it harder for you to fall asleep. We know that the half life of caffeine is anywhere between 4 to 6 hours. And so if you consume even a small cup of coffee earlier in the morning, it's going to take all day for that caffeine to leave your system. And if you continue consuming caffeine throughout the day, it's going to have an additive effect, and you're going to find that you're going to struggle with feeling sleepy at night. So if you find that you have difficulty with falling asleep at night, it could be that you are consuming too many stimulants. You might be drinking too many Cokes, drinking too many teas, drinking too much coffee, or taking caffeine in other forms. For example, headache medication often has caffeine in it. So being careful to monitor your intake of stimulants, especially close to bedtime, that can really help make you feel sleepy earlier in the night. Establishing a bedtime routine is very important. Having the same routine every night trains your brain into thinking, I should feel sleepy at this time. So perhaps it's taking a bath or reading a book, brushing your teeth, putting on certain music. That's going to help train your brain. Additionally, having the right kind of conditions for a restful sleep, having a cool, dark room. Many people really need a fan to either blow on them or just for the white noise to help them. That's really important for getting you in that mindset of sleep, and also can help drown out sounds, especially if you live in a dorm or if you have a roommate and you find that you struggle with drowning out noise and disturbances that way. Getting an app on your phone where you can listen to the ocean or have a white noise machine can help you with that. And then finally, establishing a consistent schedule. Even if you have a really early morning class, trying to maintain that schedule even on the weekends is going to help make sure that your circadian rhythm is nice and established, and you'll start to rely less on alarm clocks, and you'll start to wake up at the same time every morning. That's how you know you have a really good circadian rhythm. So a few of these things are just good sleep hygiene. Try to use your bed only for sleep. Try not to do your homework on it. Avoid screens at night so that you get limited blue light exposure. If you do have your iPad or laptop or phone, using the night mode can be helpful in blocking out some of that blue light. But really, your best bet is to avoid screens altogether. So that's really what I really wanted to cover with the end part of sleep. And then the next thing I want to cover is a different state of consciousness in hypnosis. And then we'll cover drug use. So when it comes to hypnosis, what's really important here is that you realize that hypnosis is a distinct mental state. It's not a role-playing exercise. There's actually a lot of very interesting things that's going on in the brain with hypnosis. It's a cooperative social interaction. You have a person who's hypnotized that's going to respond to suggestions by a hypnotist. And these suggestions will actually alter sensation, it'll alter perception, memory, and even the behavior in the person. So I'm not thinking of a hypnotist asking an audience member to come up, hypnotizing them, and that person acting like a chicken. We're seeing hypnosis as being used much more serious. And what's really important is to realize that you should realize is that if you do not believe in hypnosis and you don't think you're going to be hypnotized, if you're not open to suggestibility, it's pretty much impossible to hypnotize you. So about 10% of people are either very difficult or pretty much impossible to hypnotize. They're just not going to get relaxed enough. They're not going to get in a state that's going to allow them to be hypnotized. About 15% of adults are highly susceptible, meaning that they're more likely to be able to be hypnotized. And then there's a lot of people in between that could kind of go either way, and it just depends on their openness to it. Children tend to be really open to suggestibility, and so they tend to be very easily hypnotized compared to adults. But when we look at how this is used in the real world, so of course, we see hypnotists doing things like holding shows and kind of making a media circus out of it. But we do see that this is actually used in hospital systems. Hypnosis is very often used to help reduce pain. And so it can help reduce pain and discomfort when people are suffering from the symptoms of cancer, rheumatoid arthritis, and especially burn wounds. So we find people who have excessive wounds due to a burn. Maybe they were in a fire and they have 80% of their body that is burned. If you get a person who is able to get them into a distinct mental state that can get their mind off the pain, because the pain alone can actually it can actually kill you. So if you get a person under control in terms of controlling their pain, especially acutely when the person has experienced the burns at first, it can really help with their survival rate and help with their quality of life. So there's a lot of chronic pain conditions that hypnosis is used. When women go through childbirth and experience labor, they can go through hypnosis in order to reduce the pain and discomfort associated with labor. Some people prefer to use hypnosis instead of narcotics after they've had a surgery so that they can recover more easily and better without the use of chemicals or drugs. Athletes can use it to improve their concentration, motivation, and performance, and there have been teams that have brought in hypnotists to help with an athlete's focus. We've also found that using hypnosis can help reduce asthma attacks and help not only reduce the frequency of asthma attacks, but the severity. So there's a lot of anxiety involved with asthma attacks. A person might start to panic because they can't breathe. And a hypnotist can help them develop strategies to calm themselves during an asthma attack. We also find that it's helpful in eliminating recurrent nightmares, especially if the person has experienced any kind of trauma. It also can be used to help with certain unwanted behaviors like overeating and smoking. It can be used to help reduce stuttering. And also during dental procedures, it can help suppress the gag reflex. So there's a lot of a lot of ways that hypnosis can actually help a person. It's not just a kind of a entertainment sort of thing. There's been a lot of use in the medical field for hypnosis. There have actually been cases where people have gone through surgery and not used anesthesia and instead used hypnotism. This is very rare, and it's not done obviously often. And it has not shown to be extremely successful in lasting the entire procedure. So as we're on the chapter of consciousness, sleep and attention, hypnosis, drug use, all of these things can alter consciousness. So that's why it's important to cover all of these things. When it comes to psychoactive drugs, this is a very, very general category of drugs, of chemical substances, not just illicit drugs, not prescription drugs necessarily, just a whole category of chemical substances that can alter your arousal, your thinking, your mood, your sensation, and perception. And then we have very broad categories even underneath the psychoactive drugs. So we're going to cover depressants, opiates, stimulants, and psychedelics. But just so that you guys are familiar with these sort of broad categories, when it comes to depressants, this is any kind of chemical that's going to depress or inhibit your brain activity. So, for example, alcohol is a depressant. Opiates includes anything that's related to morphine or derived from the opium poppy. Those relieve pain and can also produce a feeling of euphoria. The stimulants are going to be anything that's going to stimulate or excite your brain activity, which includes things like caffeine and nicotine. And then psychedelics is going to be anything that's going to distort your sensory perceptions, for example, marijuana. So when we look at the effects of what addiction does to the brain, it does in fact change your reward circuitry. And so if you look at the pictures to the left, you'll notice that these are what we call comparison or control subjects. These are people who are not addicted to drugs. These are, control participants who do not have any kind of addiction. And then on the right, you can see the specific kind of drug abuser. At the top, you would see cocaine, in the middle, methamphetamine, and the bottom, alcohol. And what you find is that the bright reddish orangish color shows more of the dopamine pathway activation. And so in a person who is not addicted, you see that there's a lot of activation in the dopamine network. And this is the reward system. This would be the pleasure that you receive from doing something that you enjoy. If you are in love with someone, you'll see the circuitry activate because you enjoy spending time with them, and that is something that you enjoy about that person. So whenever you see something that's pleasurable or that you like, you'll see this kind of activation. Now, if you notice the drug abusers on the right, they don't have quite as much concentrated activity that compared to the control subjects. And so what happens during drug addiction is that it sort of hijacks this pathway, and it will, in fact, decrease the amount of dopamine in the system, and it sort of weakens it. And so things that were pleasurable before, things that you enjoyed and loved, aren't as pleasurable after the addiction. And so it takes more of that thing to feel the same way. And so what's really kind of unfortunate about this process is because it reduces the number of dopamine receptors in the reward system, things aren't as pleasurable anymore. And the things that used to make you happy don't make you happy anymore. And any kind of drug, any kind of chemical can have an effect on your brain. And so in order for a particular chemical to have an effect, usually they're going to do so in multiple ways. So they can increase a neurotransmitter or chemical in your brain or decrease it. They can block a neurotransmitter. They can mimic and bind. They can influence other neurotransmitters. And that when they do this, they're going to alter transmission. They're going to alter, in some cases, physical form, physical shape of the synapses. And we tend to see that is going to sometimes, in some cases, depending on the drug, be irreversible. So some drugs tend to do irreversible damage, and then some are much more recoverable than others. Now, just to cover some basic terms on talking specifically about psychoactive drugs. Now, one term that I don't have on here is addiction. And addiction is a condition in which a person feels psychologically and physically compelled to take a certain drug. And so we're going to talk about what drug abuse is, what the definition is, and what the definition of some of these terms are when we often talk about this in drug use and addiction. So a physical dependence is when your body and your brain has physically adapted to need that particular drug. And so we actually see changes in physical structure, and we see changes in how neurotransmitters are released. And that is reflected by use of particular drugs. A drug tolerance is when you need more and more of the drug to get the same effect that you got when you initially used it. A really good example of this is caffeine. So many of us use caffeine. We might drink a cup of coffee in the morning, and then over time of drinking that cup of coffee, you might find that it's just not doing it for you. It's not keeping you as alert as it once did, and you feel like you need more of it. This is evidence, physical evidence, that you've actually built up a tolerance for the caffeine. In essence, what's happening is your brain actually creates more receptors, and it makes you less likely to be able to gain the same effect. So what we do is we increase the amount of drug that we're taking. We increase the dose. So if a cup of coffee isn't doing it for you because the number of receptors have increased, then you will drink another cup of coffee or get more of it. And then in essence, continuously having to up your dosage over time. Now, if you're taking a medication that you're developing a tolerance to, let's say you have to take an opioid after surgery. Let's say you're given morphine or you're given Valium, and you have a chronic pain condition, or post-operative, and you're still in a lot of pain. You can develop a tolerance to opioids as well. And so the same dosage isn't cutting it in terms of dealing with your pain. So we can increase the dosage and keep doing that, or we can try to change the medication to try to get the same effect of another drug. When it comes to withdrawal symptoms, this is anything that's unpleasant. It's an unpleasant physical reaction when you stop using the drug. You also see an intense craving, usually because you want to get rid of those unpleasant physical reactions. I'll use caffeine as another example. If you've ever quit cold turkey and said, okay, I'm done, I'm not going to drink any more caffeine, what you'll find is that you're going to feel really bad. You're going to feel sleepy, you will probably get a headache, and you're not going to feel good. And you're really going to feel the effects, especially if you quit the chemical completely. Like if you quit caffeine cold turkey, you're going to really feel miserable for a few days. Now, a drug rebound effect is a specific withdrawal effect that you're going to feel that is the opposite of the intention of the chemical. So in the case of caffeine, if you go quit cold turkey, a drug rebound effect might be feeling very tired and very sluggish, because the opposite effect, obviously caffeine is a stimulant and it's going to stimulate you and make you feel alert. So a rebound effect is the opposite of that and making you feel sleepy and groggy. Drug abuse is something that a lot of people throw around, the term drug abuse, and don't realize that it's actually got a very specific meaning. So drug abuse is defined as any kind of recurrent drug use where you see a disruption in some dynamic of a person's life. So this could be academics. Maybe they stop going to class, or they show up late because they're high or hungover. The social dynamic of their life. So, for example, they don't go out with friends anymore, they become reclusive. Or something to do with their job. So, for example, let's say they get fired because they're hungover and they don't show up to work. Or if they have any legal or psychological issues. So if they're in a situation where they were pulled over because they have an illegal drug and now they're going to jail, that person is experiencing an issue in this legal part of their life. Or if it leads to any sort of psychological issues. And so you only need one of those areas of your life to be affected by recurrent drug use in order to be considered a drug abuser. Often we find that people have issues with multiple areas of their life, not just social or job or occupational. They tend to have issues across the board. But drug abuse, by definition, only requires an issue or disruption in one of the aspects of your life. Now, finally, change in reward circuitry. This is something that we just discussed with this picture right here. So when we look at that activation, those normally reinforcing experiences, eating a piece of cake, playing with a puppy, things like that, those normal everyday experiences of everyday life are no longer as satisfying or as pleasurable as they once were. And that's because the drug addiction has hijacked this reward circuitry and changed the dopamine release and weakened the system. Now, when it comes to the different categories of drugs, let's first talk about alcohol. So let's talk about depressants, and then we'll get to alcohol as our first example. So a depressant is any particular drug that is going to depress or inhibit the central nervous system activity. And we find that what we typically see here, is chemicals that are going to produce sleepiness, drowsiness, sedation. We're going to see that some of these depressants are going to lower anxiety, lower inhibitions, and they tend to produce additive effects, meaning that if you combine depressants together, you'll see a stronger effect. So if you combine alcohol, for example, with a sedative, then you will see that the person becomes even sleepier than if they were just taking one of those drugs by themselves. So a few kinds of depressants is alcohol, which we'll cover first, barbiturates, and barbiturates, those are specific to reducing anxiety, promoting sleep. Nembutal is an example. They can also depress the brain's respiratory centers. And so if you overdose on barbiturates, it can actually lead to a person to stop breathing, and it can kill them. An example, a sort of a street drug would be Quaaludes. And so these are illegal and obviously can be very dangerous. And so if you're withdrawing from a low dose of barbiturates, you might see things like irritability. The person might experience nightmares. But if the person was taking high doses of barbiturates, we find that they could, while withdrawing, experience hallucinations. They can become disoriented and restless, and can even experience life-threatening convulsions. So if a person is going through a withdrawal, if they want to, no longer take barbiturates, then it's really important, if they were in high doses, that this is done in a sort of controlled manner, because it can be really dangerous for the person who is withdrawing from barbiturates. Now, inhalants can really be anything that you inhale that you shouldn't. For example, people inhale paint thinner and paint and different fumes, and that can be extremely dangerous because those are not meant to be inhaled. Tranquilizers would include any depressant that's going to relieve anxiety. Commonly prescribed tranquilizers include Xanax, Valium, Ativan, things like that. Now, let's talk specifically about alcohol. In society, we find that alcohol is considered probably to have one of the highest societal costs of all addictions. And it's very likely that it's because that it is legal and easily accessible. About 17 million Americans are either dependent upon alcohol or have serious alcohol issues. And alcohol accounts for about 90,000 deaths each year in the United States. And it's typically the most, it's a drug involved most in assaults, homicides, motor vehicle accidents, as well as domestic partner and child abuse. It also is the cause of fetal alcohol syndrome. So if a woman is pregnant and consumes alcohol throughout her pregnancy, especially if she binge drinks, she can essentially cause her fetus to develop fetal alcohol syndrome. And that is a specific syndrome where we see different facial deformities, and the child tends to be developmentally delayed. And this is a completely avoidable condition. And obviously the thing is to not drink during pregnancy. Unfortunately, we haven't really seen a decline. We haven't really seen a decline in the number of cases of children born with fetal alcohol syndrome, even though we have seen a lot of information go out to not drink during pregnancy. Now, what are the psychological effects of consuming alcohol? Many of you may have seen somebody who is under the influence. People tend to experience a mild euphoria. They tend to be really talkative, feel like they're in good humor, and feel extra friendly. And a lot of people wonder, okay, well, if alcohol is a depressant, why does it tend to excite people in a way that, they are doing things that they don't normally do? So, for example, you might see a person in a bar and you might say, oh, that person's attractive. I'm going to go over and talk to them. And if you had not been under the influence, perhaps you would not have had the confidence to do so, but you're more likely to go and have a conversation. What alcohol does is it lowers your inhibitions. It depresses the brain centers in your brain, in the centers in your brain that control things like judgment and self-control. So normally you would never have gone over and talked to that person because your inhibition centers are in check, and you would maybe pick up on signals that the person isn't interested. When you're under the influence of alcohol, your confidence goes up because these specific brain centers are inhibited, the ones that tell you to not go over there. And also, we tend to be very oblivious to specific signals like facial expressions and body language that tells us, for example, a person's not interested in us. And so even though you're doing something you wouldn't normally do, alcohol is still working in the way of being an inhibitor and a depressant. And so this can be obviously very dangerous and very problematic for people who tend to get in trouble when they drink. Now, another thing to consider is that as alcohol is a depressant, many people use what they call a nightcap to help them fall asleep, because depressants do make you feel sleepy and they can help you fall asleep faster. So it's traditional in a lot of places, for example, in England, to have a hot toddy right before bed, and that will absolutely help you fall asleep. Now, the problem with using alcohol to help you fall asleep is that we metabolize it very quickly. And so by the middle of the night, your body's metabolized it. And what happens is that a lot of times you'll wake up because you've metabolized it, it's kind of served its course. And some people have a difficulty falling back asleep because that alcohol is no longer in their system. And so alcohol is not a great tool to help you fall asleep because it usually ends up waking you back up and making it harder for you to fall asleep. Now, if you withdraw from alcohol, you've consumed it and you are you're dependent on it, what you find is that you can experience a rebound effect of hyperexcitability, and you might feel nervous, you might feel anxious, you might feel like accelerated heart rate. All of these things are overexcitability, and they are exactly opposite of what the depressant does. And so this is what we refer to as that drug rebound effect, which is a specific withdrawal effect seen in the withdrawal of alcohol. Now, as your blood alcohol level increases, the amount of alcohol that you consume, and that increases in your bloodstream, you're going to see the effects of alcohol get more and more severe. Starting with, just maybe one drink, you might see that release of inhibitions. You might see a little bit of impaired judgment. Person's not going to be quite as alert. They might, they're still going to have their wits about them. They can still drive legally, but it's going to, they're going to be more relaxed, but you might find that they may not make the best decisions under the influence. As we see this blood alcohol level increase, you're going to see things like the person become less and less able to function. You're going to see that people become slower to react. You're going to see that by the time you get to 0.2%, that the person is obviously intoxicated and has lost a lot of the motor capability. You might see just a little bit before that, 0.25%, the person is staggering, and you're going to see that their sensory perceptions are really impaired. They may not know exactly where they're at. And then as you continue on and get up to, for example, 0.35%, we're looking at surgical anesthesia. This is the minimal blood alcohol level that can cause death. And once you reach 0.40, you're going to see about half of the people who have enough of this alcohol in their system, half of them do die from alcohol poisoning. So this is a real thing, and you can certainly see the effects as people consume alcohol throughout a session, and it does build on itself the more that you drink. So just be careful out there. Now, when talking about opioids, these are any kind of particular drugs that are addictive, and they are derived, many of them are derived from opium. So natural opiates, opium is derived from the opium poppy. Morphine is the active ingredient in opium. And codeine is derived from either opium or morphine. And so this is a particular class of natural opiates. And then if we look at the synthetic or semi-synthetic opiates that are created in a lab, of course you get heroin, methadone, oxycodone, and then the prescription painkillers like Vicodin, Oxycontin, Percodan, Demerol, fentanyl. All of these are synthetic or semi-synthetic opioids. Now, what they do is they relieve pain. They also produce a feeling of euphoria. And the opioids do this by binding to endorphin receptor sites that are already in the brain, and it's going to mimic the effect of endorphins. If you've ever experienced a runner's high, this is when we see a huge rush of endorphins. So if you run and you run a lot and you are at the point of exhaustion and then you break through that, you can experience something called a runner's high. And that burst of endorphins is very similar to the same feeling that you see with the euphoria experienced with opiates. And so what happens is that if you're experiencing the runner high, you will find that if you were in pain, if you had a cramp, that's all gone. If you feel tremendous, you can conquer the world, you can continue running for the rest of your life. It feels amazing. And this is the feeling that people tend to experience with opiates. We also find that because the endorphin receptors are involved with pain, when you are taking opiates, it does alter reaction to pain, and it's going to reduce your perception of the pain. Now, if you take Tylenol works on your peripheral nervous system. It doesn't cross the blood-brain barrier. Ibuprofen, Tylenol, all these pain medications work at kind of a surface level, whereas opiates and the other kinds of specific pain medications that we see, like Oxycontin and Vicodin, they're actually crossing the blood-brain barrier and they're binding to these endorphin receptors. And so that's the difference between like a pain med like a Tylenol or ibuprofen, or, Tylenol being acetaminophen. And then we see Oxycontin, Vicodin, morphine. These are the types of things that are binding to brain receptor sites or neurotransmitter receptor sites. Now, if you are addicted to opioids, and then you decide to withdraw, the withdrawal process is not life-threatening, but it is not unpleasant, okay? There are some serious drug rebound symptoms. For heroin specifically, you see intense cravings, but opioids, they are going to have some really serious rebound effects because it slows down your digestive system. So if you've ever had to take something specific for surgery, and you've taken it for maybe a week or so, what you find is that it stops up and slows down the digestive system. And so if you are using opioids for a long period of time and then you withdraw from them, you can experience some very intense and disturbing gastrointestinal issues, because your systems have been slowed down and now they're jump started back up again. So that can be really serious. You also can see things like fever, chills, and muscle cramps as being a part of the withdrawal, and it is not pleasant. In fact, a lot of people try to cut back, and they start to experience these issues and the pain. And obviously, in a lot of cases, people are taking opioids because they have a pain issue, and it will exacerbate the pain. It'll feel even worse than it did before. And so opioids do tend to be very difficult to quit if you're addicted. So stimulants, anything that's going to increase your brain activity. And so we have some examples here: caffeine, nicotine, amphetamines, and cocaine. And we're going to cover each one of these individually. We've already talked a little bit about caffeine. So this is it's going to make you feel less sleepy. You're going to feel alert and awake. You're going to feel more vigilant. You're going to feel like you can think faster and operate faster. It tends to stimulate dopamine in your prefrontal cortex, which is probably why you feel like you can think faster. Caffeine works by blocking adenosine. And so adenosine helps make you feel sleepy. So if caffeine blocks adenosine receptors, it in essence is reversing the effect that adenosine has. The problem is that as you consume more caffeine and block those adenosine receptors, your brain is going to fight back by producing more adenosine receptors. And so that is why we tend to develop a tolerance for caffeine, is because our brain really wants us to feel sleepy. And so it's going to multiply those adenosine receptors. And so you're going to need a constant increase in dosage in caffeine in order to continue remaining feeling alert and the same kind of wakefulness that you experienced initially. Now, caffeine can make you feel anxious and restless. It can also increase heart rate as it is a stimulant, especially if you consume too much over what you are used to. It can make you feel shaky. It does tend to disrupt normal sleep patterns, especially if you consume it closer to bedtime. You can also find that if you have a sleep disorder, for example, if you have sleep paralysis, if you have a non-REM parasomnia, for example, sleepwalking, if you sleep talk, if you have issues where you are moving around and during slow wave sleep, then don't consume caffeine later in the afternoon or evening, because it will exacerbate this issue. I can tell you from experience that I will almost always sleepwalk if I consume caffeine after 5 p.m. And I do some crazy things, and a lot of people do crazy things during their during sleep if they consume too much caffeine too close to bedtime. Now, nicotine is another stimulant that is going to increase activity in brain areas like the frontal lobes, the thalamus, the hippocampus, and the amygdala. It also is going to increase your mental alertness. It's going to make you feel more awake. You're also not going to feel as fatigued or drowsy. But nicotine has a lot of negative effects, and if you try to withdraw from nicotine, you're going to experience sometimes some irritability. You're going to feel jumpy. You might experience some tremors and headaches. And then you're going to experience some rebound effects like drowsiness, brain fog, and lightheadedness. Because remember, if nicotine is making you feel alert and make you feel focused, then the drowsiness and brain fog, those are going to be your rebound effects. When it comes to amphetamines, excuse me, these stimulate brain activity as well. It doesn't increase mental alertness. It reduces fatigue, just like the other stimulants. It produces a sense of euphoria and can improve your mood. It also suppresses your appetite. And a lot of people who are addicted to certain kinds of amphetamines tend to lose weight really quickly because it's suppressing the appetite and the person is just not eating. Benzedrine, dexedrine, these are prescription amphetamines. It's also used, amphetamines are sometimes prescribed for ADHD and other conditions like that. Methamphetamine, or meth, is an illegal version of amphetamine and obviously can be very dangerous. Now, when we talk about withdrawing from amphetamines, you're going to see rebound effects like fatigue. The person might sleep a lot. They might feel depressed. And of course, you're going to see the rebound of increased appetite since it suppresses appetite. You might also find that a person feels a psychological dependency. So it may not be a quote unquote physical dependency, but they might like that euphoric rush that they get when they take the amphetamine. Especially considering drugs like methamphetamine, it can do irreversible neurological damage and extensive damage, especially to the frontal lobes. And we've talked about the frontal lobes being really important for decision making, important for, in cases, sometimes personality changes. It's really the area of your brain that kind of makes you who you are. And so you definitely don't want to see damage in that particular area because that can really affect your ability to adjust to society. And very likely because of that neurological damage, especially in the frontal lobes, you're seeing cognitive and social skill deficits. The person's not able to adjust like they did. They're not able to pick up on social cues like they did. And they have a really hard time just kind of having a normal life. We also see that a person during withdrawal tends to feel depressed. They may become sort of unstable, where they might feel angry, they might feel sad, and they might rotate through these emotions. And these are kind of extreme emotions. The person will act impulsively and a lot of times violently, and they tend to react to the extreme. It can take years for this kind of behavior to resolve, and in some cases, it's irreversible. So we can see years to help recover from the brain damage in some cases, and then sometimes we see a little bit of recovery, but unfortunately, the person is just not the same as they were. And of course, the more serious the drug use, the less recovery we tend to see. Now, this is something really interesting here. Now, this particular ad was used to sell cocaine toothache drops. And so a lot of people don't realize this, but cocaine and a lot of other drugs were legal and they were used in medications. So prior to 1914, cocaine was legal in the United States, and it was widely used as an ingredient for over-the-counter medication. And so very similarly, opiates were also used legally in medications and could be bought over the counter. And so this particular ad was circulated in 1885, and this was an advertisement for cocaine toothache drops. And so if you notice that this was used to treat both adults and children. And so we still see cocaine derivatives being used today. For example, Novocaine and lidocaine are still used medically as anesthesia. And of course, many of you already know that cocaine was part of Coca-Cola's original formula back in 1888. Now, in 1903, they replaced cocaine in Coca-Cola with another stimulant, which is caffeine. And so the interesting thing is that, of course, caffeine is just an alternative drug in the Coca-Cola recipe. It has the same stimulating effects as cocaine. Okay, so those were the stimulants. Now let's finally wrap up with psychedelic drugs. Now, psychedelic drugs or any kind of drugs that's going to change your perceptions, alter your mood, affect your thinking. The word psychedelic translated actually means mind manifesting. And so this picture on the right here is a peyote-inspired vision. This is a particular, so in this case, peyote is an example of a psychedelic. It's derived from a cactus. Mescaline, LSD, psilocybin, and marijuana are all examples of psychedelic drugs. Mescaline is the psychedelic drug that's derived from the peyote cactus. LSD is a synthetic psychedelic drug, and it mimics serotonin in the brain and can stimulate those serotonin receptor sites in the somatosensory cortex. And if you guys remember, the somatosensory cortex is important for experiencing sensations in your body. Unfortunately, LSD can provide what we kind of refer to as bad trips. We can see that sometimes we can see things like flashbacks. So adverse reactions might also include depression. Prolonged use could lead to some psychotic reactions over time. Psilocybin is sometimes referred to as magic mushrooms or shrooms. And marijuana, of course, many of you are probably familiar with, which we will go through individually. So we'll talk about marijuana next. So the active ingredient in marijuana is tetrahydrocannabinol, or as most people know it, THC. And many of you are familiar with cannabinol, which is CBD, and that's becoming a very commonly used supplement. It's sort of blown up out of nowhere, and CBD oil is becoming a really popular treatment for literally everything. At one point, CBD was incredibly illegal, and it was essentially derived from the hemp plant in order to treat things like Dravet syndrome, which causes epileptic seizures. There is a strain called Charlotte's Web, if I'm not mistaken. And so that particular strain was used specifically to treat epilepsy. And it caused a lot of issue with people saying that marijuana should not be used to treat anything because it's an illegal drug and it should remain illegal. And of course, it's legal in a lot of states now. But it's one thing that has gathered a lot of really interesting followings. And we still don't really know what is actually going to happen with the particular oils out there. So they haven't really been tested in terms of use for a lot of the things that we see it used for. So what's really interesting is we don't know what it's going to do. We don't know if it really does help. There have only been a very few number of studies done to test CBD, even for epilepsy. All the studies have been very promising, though, and have shown that marijuana, or I should say CBD specifically derived from marijuana, has been extremely, extremely successful in treating different conditions. So the problem is that if you look at marijuana as just a drug that we can lump with LSD and mescaline and all of that, it's difficult because we've learned that marijuana is and the chemical components derived from marijuana are sometimes, some people call them basically miracle drugs. Okay. It's very difficult to say, okay, that this is the same class as LSD or mescaline. When you look at really high doses of marijuana, we do see sensory distortions. Some people do have difficulty with muscle coordination, difficulty with perception. And of course, they're not able to drive because their alertness and reaction are impacted. And so when we look at really high doses of marijuana, we know that, of course, that can be really dangerous. Now, how does marijuana work in the brain? We have a naturally occurring brain chemical, which is adenamide, and that is important for regulating transmission of pain signals and helps to reduce painful sensation. And so we have brain sites and receptor sites that respond to THC and respond to the same or a similar chemical makeup. And so when you look at how this is occurring in the brain, we find that those particular conditions that are specifically related to very hard to manage pain, marijuana as a treatment has been shown to be quite successful because these binding sites are so similar. So any kind of condition where you're experiencing some serious pain, okay? So for example, rheumatoid arthritis, when you're having a lot of really serious some pain conditions, epilepsy, where you're seeing a very large number of seizures. A person might be having hundreds in a day. It can help calm that overactive excitability in the brain. It's also been shown to be effective for hypertension or high blood pressure, and helpful in reducing the feelings of nausea. We typically associate this with people who have cancer and who are undergoing chemotherapy. And so if a person has cancer and they are experiencing extreme nausea because of the treatment, and we have a way to reduce that nausea and allow them to reduce the amount of weight that they lose, and in essence, we're helping them become stronger and not as weak. That is definitely something that has been shown to be incredibly helpful for people who are undergoing particular treatments like chemotherapy, that the side effect is almost always nausea. Medical marijuana has also been used for the treatment in glaucoma as well as asthma. And just because THC or CBD are components in marijuana, and we can actually get specific strains that are bred out to contain a very small amount of the chemical that actually gets you high. You don't have to necessarily smoke marijuana in order to get the effect. So many children, for example, who have Dravet syndrome or have very severe epilepsy don't actually smoke marijuana. They're given it through an oil or a pill form. And so that way they're able to maximize the benefit of the chemical without, puffing on a marijuana bud. So the even in just the last few years, the attitude towards marijuana has changed pretty significantly. So just a review over the chapter. We began the chapter talking about consciousness and attention. We talked about sleep, sleep-wake cycle stages, circadian rhythms, things like that, and how that works with the brain. We talked about hypnosis. Even here in this segment here, we talked about hypnosis, and then we talked about the different drugs, different types, and then how they interact with the brain, and as well as going through withdrawal. If you have any questions, please feel free to email me or contact me, and I'll be happy to address those. So have a wonderful day, and good luck on the quiz.